please accept my congratulations as this year's recipient of the Chancellor's Medal for Distinguished Teaching. The person who receives the Chancellor's Medal for Outstanding Teacher is accorded the privilege of giving the last lecture, if you will. What it is a celebration of teaching that occurs in the American university. Dr. Durbin, or Jerry as he much prefers to be referred to, is the doctor's doctor, a pediatrician who has taken care of thousands of children throughout his career, but is best known at our medical school for his commitment to teaching.
This was very meaningful for me to receive this honor. I have clearly loved working with students and residents here. The school has always been dedicated to education and having, first of all, our students and our residents focus more on primary care than many other schools do, but also the fact that the faculty are rewarded here for teaching, and that has always been something that faculty take seriously because the administration of the school takes it seriously. And so I knew from my first days here that I would be welcomed as a teacher. My talk will be more up here on the wards, and it will be more focused on small group teaching, as most of us do in clinical teaching. That is, we are working with one student and one resident, or a small group of students and residents, and so it's much more sort of classic clinical bedside teaching. What I'd hope to do is go through some of the techniques that have worked for me and for other faculty from our department over the years, and I especially will emphasize the fact that you don't have to be a Superman personality to be a good teacher here, and the fact that I received this teaching award as someone that people see as more quiet and humble, and I think is really a message I want to get across.
I've known Jerry for 9 years. We were just doing the math, and the first time I met him was as a first-year medical student. I've known him as a preclinical student, clinical medical student, and then as a resident, and now as a chief resident. And I'm going to be part of the faculty in the primary care office where he works. So I've had the opportunity to know Jerry through all of these different settings. What's remarkable is that he's a good teacher in all of those settings. So no matter what your training is and what your level is, he is able to know where you are and teach at an appropriate level, which I think is definitely a sign of an excellent teacher.
He is a consummate physician, an outstanding teacher, and a fine human being. And I think that all of us will look forward to his last lecture this year.
I feel very lucky that I've had this job. Sometimes I compare what I do with other friends of mine, and I sometimes say to myself, how did I get so lucky that I get to work with these wonderful, gifted, caring, excited young individuals, and that I get to work with them every day, all day long, and it's pretty special.